Thank you for agreeing to participate in the Mosaics study. We aim to describe aspects of osteoarthritis management in general practice using anonymised data. The best way for us to do this is through the use of computerized coded information. We hope that you will be willing to use a computer template within EMIS to record information gained when consulting with patients regarding osteoarthritis and joint pain. I would like to demonstrate the template to you. I hope to show that the template is brief, intuitive, and integrates well into a consultation. The template will be triggered by a variety of problem titles and codes, which are considered to reflect the possibility of a working diagnosis of osteoarthritis.
I would like you to imagine a scenario in which a patient presents with foot pain. In this example, I propose that the diagnosis is biomechanical pain rather than osteoarthritis. Thus the problem title foot pain can be entered, and the read code 1M11 foot pain selected, which triggers the template as it is a candidate code for a working diagnosis of osteoarthritis. However, in this scenario it is considered inappropriate to use the template, and so by pressing the escape key and selecting yes to the exit without filing prompt, the usual method for recording information can be used. In a second scenario, a patient consults with knee pain. This is considered to be due to osteoarthritis. We enter the problem title knee pain and select the read code 1M10, and the template once again fires. This time the template is completed as it is considered to be relevant. The same process would be followed if an osteoarthritis disease code commencing N05 is entered. Information may now be recorded against the system prompts for each of the domains on the single screen shown. For this example, I will complete the template selecting one of the options from each domain. Thus for pain, the severity can be recorded against the broad groups offered, ranging from no pain through mild and moderate to severe pain. For recording information on the degree of functional impairment, a summary assessment can be coded with options ranging from not limited through mild and moderate to severe limitation. For weight, the numeric value entered will allow the system to calculate the body mass index automatically if a patient's height has previously been recorded. A previous trial of paracetamol at a dose appropriate to that patient can be recorded, as can advice to the patient to try paracetamol to an appropriate maximal dose. If a patient's preference is not to use paracetamol, this may be coded as declined. If such a trial is not considered to be clinically appropriate, the response not appropriate may be used. Unknown is also an option if required. The same options are provided for topical anti-inflammatory agents. A previous trial of topical anti-inflammatories at a dose appropriate to that patient can be recorded, as can advice to the patient to try topical anti-inflammatories up to an appropriate dose. If a patient's preference is not to use topical anti-inflammatories, this may be coded as declined. If such a trial is not considered to be clinically appropriate, the response not appropriate may be used. Unknown is also an option if required. Provision of information about osteoarthritis may be recorded as verbal advice or verbal and written. If information is not given in a consultation, that can also be recorded as not this time. In some circumstances, information provision can be considered not to be appropriate, and this might be noted too. Similarly, advice to the patient about weight management may be recorded as verbal or verbal and written. If such advice is not given in a consultation, this may be recorded as not this time. It may be that provision of weight advice is not considered to be appropriate, and this may also be recorded. The same options of verbal or verbal and written are offered for recording advice about exercise and physical activity, with the addition of a not necessary category. This may be used if a patient is already undertaking exercise and physical activity deemed to be of an appropriate type, intensity and frequency. The other options of not this time and not appropriate remain available. Likewise, physiotherapy referral may be considered and recorded. In this case, it is the offer of a referral or advice to contact an open access or triage service that should trigger the offered referral prompt, not only cases in which the referral was accepted. In some cases, physio-referral may not be considered necessary, such as in patients who are already well aware of the type of exercise to do. This may be recorded as not necessary. If a referral is not offered, or has previously been recommended and not reiterated, or it is not a current treatment strand, this should be recorded as not this time. Not appropriate can be used in circumstances where such a referral is not a clinically appropriate course of action, such as in someone unable to participate in a physiotherapy treatment. At completion of the template, the information can be filed by pressing the return key, and the record then used as normal to record any other information necessary in the usual data entry manner.
This has been a brief overview of the template. I hope that I have demonstrated that it is practicable to use and that you will be willing to use it when consulting with patients regarding osteoarthritis and joint pain. You may have further questions about the template and its use. In the first instance, please contact June Handy, the study coordinator. Her contact details will be coming up on screen shortly. Thank you very much.